someone can reach out to us whenever they want. At the very least, this service can offer that feeling like someone's always going to be there for them. This is First Response. Jason speaking. How may I think the most recent one that sticks out for me was a case where an individual had not reached out for help before, had reached crisis point for them and didn't know where to turn, so they just picked up the phone, made a call with no expectation of what they were going to get. In that call we spoke about their life, what they'd been through over the past 5-10 years, where they were today and how that was affecting them. And in the space of 48 hours we'd managed to coordinate him moving closer to his children, having a package of food, being referred to a package of care that would likely meet most of his needs. And a few days following those 48 hours of intense sort of support, mostly over the phone, he contacted the service to say how thankful he was and the things that had happened, and it was nice to know that services really do care and there are people out there that will go the extra mile. And it could be perceived as a fairly simple example, but it really helps you remember why you get into the job and the things that you love about it. It makes me feel quite emotional knowing that someone has genuinely been touched by something that me and my team have done to help their life be a little bit easier. Every day is different, so monotony is not synonymous with being a mental health nurse or any mental health professional. You have to be ready to be dynamic in your approach and make sure you really listen to what someone's trying to tell you. Even if you already think you know the answer to what their problems may be, it's an experience for them to talk to you about how they are as a person, their feelings, what they're going through. The advice I'd give to anyone who's considering a job in mental health nursing or working in mental health services is to think strongly about the things that are important to you and the lived experiences you've gone through, and use that as your evidence base as how you might want to support someone who's going through something similar, how you might be able to understand someone in a way that only lived experience might be able to provide. And that could be the stepping stone into a career that you find that you have a great deal of knowledge and passion for. That's part of the reason why I love the job so much. You build a rapport with some of the patients that are in a really vulnerable place, struggling with things in their life, and it fills me with an overwhelming sense of pride and joy when a patient succeeds. While it is nice getting to know the person, knowing that they never need the service again, partly because of the things that you've put in place or the encouragement you've given them to reach out and ask for help, it's undescribable how that feels.